Hello, I'm Kevin Everett. I'm an associate professor in the Department of Family and Community Medicine at the University of Missouri. In this presentation, I'm going to work with you to help you improve your tobacco cessation counseling skills. One of the first things that I want to review is the understanding of characteristics of somebody who can be a good counselor. One is to be an active listener. The other is to be someone who demonstrates understanding and empathy to the situation that you're dealing with. Finally, we need to have people who are knowledgeable on the topic. And lastly, let's think about watching how you use judgment in your tone and in your reactions to patients. So let's get started. Best practices have been identified for working with patients to help them quit smoking or using tobacco. And those best practices include identifying all patients or clients who use tobacco, assess their tobacco use and their readiness to quit, and finally, provide assistance to a person who is ready to quit, and that's by developing a plan to quit. These best practices come from the Tobacco Use and Dependence Clinical Practice Guideline that's reviewed over 6,000 studies on tobacco use. Presented today is the 5 A's, and that is a schema that will help you be able to work with all patients. The first A, ask every patient about tobacco use. In that, we want you to be systematic. Your organization should develop a plan that would identify all tobacco use. Have a screening instrument that becomes part of the medical record. Have this question asked at every visit. And this will require organizational commitment. Next, you've already identified those who smoke. Go ahead and advise quitting to all tobacco users. That advice needs to be in the form of direct advice. Some examples. I strongly advise you to quit smoking. It's one of the most important things you can do for your health. Or, I need to advise you that your smoking is putting you and your children at risk for more health problems. I'm willing to help you quit. What do you think about this information? Even more important, you could tailor the advice to quit to a person's presenting medical problems. You'll now see a demonstration by Dr. Mark Beard of how to make sure that you ask and advise a patient to quit.
Okay, Angelica, I know we've talked about a lot of things going on right now. I'd like to get to know you a little bit better, kind of just your lifestyle and kind of how you live, just so I can take care of you the best way possible. Do you use any tobacco products?
I do.
Okay. Chewing tobacco, cigarettes? Okay. Do you think we can get you to quit?
Right now is not really a good time. It's just really stressful.
Okay. I would advise you to quit smoking. We would always want our patients to quit smoking. It's something that I'll probably continue to bring up on occasion, and understanding that hopefully in the future there might be another time that we can talk about options to help you quit smoking. It is something very important, and we'd really advise you to quit in a future time. So if it's okay, I'd like to talk to you at least about some of the options to consider to help you quit smoking and what's available for you, and maybe at least plant a seed or an idea that you can think about as we continue to work on your stress over the next several weeks, as I continue to kind of help you with that. So have you heard about any options available for people to help them quit smoking?
I did hear some stuff about some medications.
Okay.
I don't know a lot about it, but
Yeah.
I did hear that there were medications available.
Yeah, one of them is Chantix. You may be seeing that on the television. Chantix is a medication that acts on the nicotine receptor and kind of helps control that craving for the nicotine. Another one is Zyban or bupropion, and it kind of changes the taste of smoking and kind of the drive to smoke. And both of those are options that we could definitely consider for you. We make sure that patients aren't at risk for worsening depression or anything as we prescribe those, but definitely would be a safe option for you, I think, if that was something you wanted to try. Then the other kind of major group are the nicotine replacement type medications and therapies. So like the nicotine gum.
Oh yeah.
You've seen that probably at checkout at the store, or the lozenges or the nicotine patches. and they replace the nicotine that you get from smoking. They don't necessarily fix the routine. You know, in the car you get that cigarette, or you have the cigarette with that morning coffee, or first thing in the morning you turn to that box of cigarettes, and that we'll have to consider that and fix that for you if we were to work on quitting smoking. You know, these options are available to you. I would definitely want you to at least consider them, and in the future, if we get to a point to be able to talk about quitting smoking, I think we'll probably need to rely on one of those options or therapies to help you along the way. But I do want to emphasize the importance of quitting smoking, and I'm concerned when any of my patients are smoking about the health risks that are associated with that, and understanding that while we work on your stress right now, you might actually find even some relief or benefit from some of the things we teach you in managing stress that will actually help you with quitting smoking too, as we kind of go along the way here, because there are techniques we teach patients to help them with stress and to manage stress that actually will help you with the cravings and can actually help you with quitting smoking in the future as well. So this will be a work in progress. This was definitely something that I'm going to continue to bring up, and I think I'm concerned for your overall health, and we'll continue to talk about it. But I appreciate you being willing to at least talk to me today and let me kind of explain some things and options that are available to help you quit smoking at this time. And, so let's talk a little bit more about the stress in your life, if that's okay.
The next thing that we'll work with you on is thinking about how to assess a person's willingness to make a quit attempt. Questions that you can ask to assess readiness to change. Are you seriously thinking about quitting in the near future? And I would suggest that near future be within the next 30 days. Are you interested in quitting smoking? If it's a woman who is pregnant, how about, are you thinking about quitting smoking during this pregnancy? Directly ask about how ready they are to quit. So, if somebody is ready to quit in the next 30 days, your clinical task is to move on and work with them to develop a quit plan. If they're not ready to quit, acknowledge that lack of readiness. Hey, I see you're not ready right now. Let me hear a little bit more about your tobacco use, even though I know you're not ready to quit. A hospitalized patient, you might need to say, I understand you're not ready to quit, but while in the hospital, you're not going to be able to use tobacco. We can offer you treatment options that will reduce or eliminate your discomfort. Would you like to hear about these options? What about those who are not ready to quit? Well, you do not want to focus on a quit plan. They're not ready for that. So maybe a statement is, I hear that you're not ready to quit, but I am interested in learning more about your tobacco use, as it might help me manage your other health problems. What you can do is to take more time and learn about how tobacco use is affecting that person's lives. And always indicate that you're willing to help when they're ready to quit. So how do you start a conversation with somebody about their tobacco use? Well, you can use questions such as, what are the reasons that you're smoking right now? How about, what would have to happen in your life to lead you to want to make a decision to quit? Or use a statement. Tell me about your experiences in trying to quit in the past. Ask about if they've ever known of someone who's quit, and ask what that person did. Anything that you can do that gets a person talking about their tobacco use is useful. There are multiple other strategies you can use. You can find out how tobacco fits into a person's typical day. You can find out about what their lifestyle is like and what kind of stresses they're having, and then ask how tobacco fits into the stress. You can ask about their health and where tobacco fits in. An interesting strategy is to ask about the good things that tobacco brings in to their life, and let the patient talk about that. Oftentimes they're not used to this, and it leads to an interesting discussion. When in a pinch and short of time, provide some information about tobacco use and how it might be harming their health in a specific disease state or organ. And then say, what do you think about this information? There's all types of ways to start a discussion about tobacco use. One thing I should remind you, though, is you will often see people in a state of ambivalence or not quite ready to quit. It's one of those, I want to change, but I want to stay the same type of factors. One of the things about this state is really it's a simple cognitive behavioral conflict. It is not a pathological response. It's the way we all respond when we're facing a major change in our life. That ambivalence should be viewed as the beginning of an element of behavior change and something that you can work with. So, how do you work with ambivalence? A nice strategy is to use a phrase like this. It seems to me, on one hand, you want to change. You want to quit tobacco use because of your health problems you're facing. But on the other hand, you don't want to quit tobacco use because it helps you with your stress. It gives you an outlet when you're angry, or whatever the reason is. Once you've kind of put it into perspective where you've correctly identified the ambivalence of somebody's quitting, you will notice a patient being more willing to listen to other statements you have about tobacco use. You can also use a phrase after such conversation to say, and now I understand your situation a little bit better. Or even normalize the ambivalence by saying, I think everyone goes through this when they're considering making a major behavior change in their life. You can help a patient through ambivalence by weighing out the pros and cons of their problem behavior and the pros and cons of making a change. In many regards, this is really helpful. Think of a scale and you're trying to help somebody have the balance come down in the side of making change. An important thing to do is to let this happen by the patient describing the reasons they want to change. A quick hint is to not always take and give all of the reasons for change. If you do that, you might leave the patient only with statements to say why they don't want to change. Err on the side of letting the patient tell you the reasons for change. Another way to help understand where a person is in their readiness to change and quit tobacco is to use a rating scale. Clinicians and physicians are used to asking rating scale questions about pain and other aspects of care. Use a simple 0 to 10 scale. Ask a person how important it is for them to quit smoking on a scale of 0 to 10. Ask them how confident they would be that if they wanted to, that they would be able to quit. Importantly, when using readiness scales and hearing out a patient's answer, for instance, if they said and circled a 4 on a 0 to 10 scale, don't say to them, "You're a 4, why aren't you a 10?" Rather, think it through and say, "So you're telling me you're a 4, why are you not a 0? Can you tell me more about that?" This gives a patient an opportunity to tell, even though their motivation isn't high, there is some, and they get to talk about it, and you can build upon that. Another strategy might be, you've mentioned that you're a 4. What might need to happen for you to move from a 4 to, say, a 6? Small movements, small gains are what makes behavior change feel real for a patient. At this time, we're going to watch Dr. Beard work with a patient that's not quite ready to quit and is going to be able to explore ambivalence.
Okay, Mr. Johnson, I know we've talked about a lot of things that are going on right now. I'd like to get to know you a little bit more on a personal level. Do you use any tobacco products?
Yeah, I smoke cigarettes.
Okay. Do you think we could get you to quit smoking cigarettes?
I'm not sure I'm quite ready to deal with that yet.
Okay.
I mean, there's so much else going on, and there's a huge project at work. I mean, yeah, I understand the health issues, but it's such a I don't know, it's such an emotional thing,
Yeah.
you know, to try to quit. It's like I can't deal with that on top of everything else.
Sure, sure.
Especially when cigarettes, in some cases, are my only comfort.
Okay, okay. Well, I'll definitely, I would advise you to quit. I think we'd always want any of our patients to quit smoking. I understand that right now you've got a lot of other things going on, and I think we'll always continue to kind of come back to this. I'm concerned when any of my patients are using cigarettes or tobacco, and I think at a future visit I'd like to come back to this and talk to you about ways that we could get you to consider quitting. But today we'll focus on the things that are bothering you right now.
Okay, I appreciate that.
Okay.
And I'll work on trying to psych myself up for dealing with it at some point in the future.
Okay, I appreciate that. Thank you.
Now we're going to think about the different strategies you can use to assist a patient in helping them quit. And that would be to help them develop a quit plan. An important part of a quit plan is setting a quit date. Set dates within a reasonable short amount of time. Usually within a week to 2 weeks are a great time frame for setting a quit plan and being able to follow up with your patient. The research-supported elements of successful cessation treatment include pharmacotherapy, counseling and coaching, and then self-help approaches. And it's been proven time and time again in research that a combination of pharmacotherapy and counseling leads to the highest rates of success. Finally, think about following up. Not everyone will be successful on their first try, and so that you might be able to follow up and offer some new strategies for another quit attempt that could resume quickly. Additionally, people need support in their initial steps on the way to quitting. A follow-up time frame within a week or two is recommended. Follow-up does not have to be an in-person follow-up. Follow-up through email or telephone is sufficient. When you follow up, you may find that somebody is struggling and you can assist them. It's common for 2/3 of patients to relapse within the first month of trying to quit. Congratulate anyone who has not used tobacco at the follow-up and see if there's anything else you can do to help them. At this point, we're going to watch Dr. Beard work with a patient and watch him develop a quit plan for that patient and arrange follow-up.
So let me get a better understanding of how much you are smoking or how long you've been smoking, kind of get a history there, and then we can talk about some options for you. So when did you begin smoking?
College.
In college?
Mm-hmm.
Okay. And how much do you smoke currently?
About a pack a day.
Okay.
Yeah.
Have you ever been able to quit smoking?
I've honestly never even thought about it before.
Okay. Okay. If it's okay, I'm going to just take some notes as we're talking about this.
Absolutely.
And have you always smoked about a pack a day, or has that escalated?
It has escalated in the
with
more
some of these recent
time,
stressors?
yeah.
Sure. Yeah. What were you smoking before this more recent time? How much were you smoking?
It'd be about half a pack.
Half a pack.
Mm-hmm.
Okay. Okay. And why do you smoke? I know that's kind of a very open question.
I mean, it just started. I was in college, and
Mm-hmm.
it's kind of what we all did back then.
Mm-hmm. Mm-hmm. And now, kind of what drives you to seek
I
a
like
cigarette?
it.
You like it?
I like it.
Okay. So you like the taste of it?
Mm-hmm.
Okay. What other benefits do you get from smoking?
I think it calms me down.
Okay.
And at this point, I've been smoking for 10, 12 years, so it's habit. It's just something that I've done, and I travel a lot, so it's just something easy.
Mm-hmm. Are there points of the day where it's just kind of routine for you to have a cigarette?
My morning.
Your morning.
My morning cigarette. That's the most important one.
Okay. Kind of get you going in the morning.
Mm-hmm.
Okay. Obviously we're very much aware of the fact that patients have the dependence on the nicotine, but also there's a routine to smoking, and that can be first thing in the morning or in the car or after a meal.
Absolutely.
And there are those times of the day where the routine needs to be treated just as much as the nicotine dependence. And those are things that we talk to patients about, best ways to kind of help with that.
Okay.
Who do you smoke with? Are there family members that also smoke, or are there coworkers that smoke?
I work a lot.
Mhm.
I work as a salesman for a chemical company, and I'm alone a lot of the time, and I'm traveling a lot, so in the car is also kind of a big...
Okay. So during the travel, you rely on
Yeah,
that,
absolutely.
on the cigarettes. Okay.
Mhm.
So it sounds like, just to summarize, the taste is something you enjoy, that it helps calm you down, it kind of gets you going first thing in the morning, and then kind of during those alone times you rely on that as well. Would there be reasons right now in your life to quit? Are there family members that want you to quit, or?
I mean, my husband's kind of hinting that he wants me to quit.
Okay. How long have you been married with your husband?
6 years.
Great. What's his name?
Josh.
Josh. Okay. Obviously, many times there are drivers in the family that would kind of help someone have the energy and the drive to quit smoking. Would there be other reasons to quit? Are there some cons to smoking that you've thought about?
Well, I can tell that overall, since I recently took this position here, that my health has kind of gone downhill with traveling and all of that. So.
Okay. And smoking is a part of that, maybe that decline in health.
Yeah.
You identify that. How about other things that people will sometimes say cost is kind of a con or downfall of smoking?
Sure.
Is that a concern for you at all, or?
I mean, I guess it is, but
Okay.
this is something that I've done for 12 years, so
Yeah.
it just kind of...
part of your routine.
Absolutely.
Okay. Sometimes when people aren't quite willing to quit right away, when I talk to them, I'll ask them to kind of give me a sense on a readiness scale of where they might fall on quitting. So if, like, on a scale of 0 to 10, 10 being I'm absolutely ready to quit right now, and 0 absolutely not, with some of the good and the bad that we've talked about, where would you put yourself? Where would you rate yourself?
Maybe like a 1 or a 2.
1 or 2.
Mhm.
Okay, so really closer to that absolutely not ready to quit right now.
I mean, it's just not something that I think about,
Okay.
It's part of my lifestyle.
What, if anything, would maybe bring you up to a 3 or 4 or even a 5? What would have to happen, or what would change?
Less stress in my life.
Okay.
Absolutely.
So obviously a big piece of this is how it helps you calm down and helps with the stress. If there was something that I could do as your physician to help with the stress, would you then maybe be able to reconsider quitting smoking at that time?
I could consider it, yeah.
Okay. Because I think that, there are definitely some things we can talk about that might help you with the stress that you're facing in your occupational life and in your personal life. And if we can get that under control, then I'd really like to reconsider talking to you about quitting smoking. I think it's something very important for your overall health, and I'm concerned about any of my patients that are smoking, because of the the risks that are well known to us of smoking, and the risks to your health. Obviously, it sounds like Josh, your husband, wants you to maybe consider quitting, and so I think I'd like to really work with you on getting the stress under control and continuing to revisit, can we get you to quit? Have you ever considered any of the medications or the nicotine replacement options?
I honestly don't know a lot about that.
Okay.
So, if your office setting happens to be busy that day and you're not able to take the time, the 5 to 8 minutes that it may take to develop a quit plan for someone, here's another idea. You can use the 5 A's and shorten it to 2 A's and an R. And that would be to ask everyone who smokes, advise everyone to quit, and then refer all tobacco users. So what can you refer to? You can have knowledge of counselors or classes in your community for helping people quit smoking. All people in the state of Missouri can call the state tobacco quit line at 1-800-QUIT-NOW, and that will lead them to trained coaches on the telephone who will work with them at any level of readiness to quit and help them. Finally, there's also web-based cessation services that are useful as a means for patients to quit. Within those services, people can sign up for cell phone text programs as well as smartphone apps in order to be able to help them quit. All of these are evidence-based and proven best practices. In summary, I encourage you to systematically address tobacco use with every patient. Become knowledgeable of the evidence-based nicotine dependence treatments. There are 7 available, 2 medications and 5 nicotine replacement therapies. Follow the 5 A's or the 2 A's and an R strategy. Always document your intervention so that your team or other clinicians will know where that patient is in their readiness to quit. Demonstrate understanding, support, and empathy for patients trying to make this major behavior change. Thank you for your time, and good luck working with your patients.